Hello everyone. Today I'm going to discuss about disorders of blood coagulation, and this is part 2, that is the continuity of the first video where we have discussed about APS. If you are new to my channel, don't forget to subscribe the channel to get the notifications of daily uploaded new educational videos. Stay tuned. Let's go to the tutorial now. So, antiphospholipid antibody syndrome, which we have discussed in our first video, just a bit of revision. It is an autoimmune hypercoagulable state caused by antiphospholipid antibodies. So, there are some antiphospholipid antibodies in our body which causes the clot formation in various arteries and veins of our body. APS causes blood clot in arteries and veins. It also provokes pregnancy-related complications like stillbirth, miscarriage, etc. We have been crossed through all this informations in our last video. Okay, what is the name? What is it's also known as Hughes syndrome and all. Now, how these antiphospholipid antibodies, they actually works. This is a very important page. So these are the antiphospholipid antibodies. You can see the names: anticardiolipin, then lupus anticoagulant, anti-beta 2 glycoprotein 1 antibodies. So these are the antiphospholipid antibodies which ultimately causes thrombosis, that means coagulation or of blood inside the important veins and arteries of our body. And this antiphospholipid antibodies, they actually works on monocytes, platelets and endothelial cells, or directly with the activation of the complement system. So when antiphospholipid antibodies, they work on the monocyte, they cause the upregulation of tissue factor expression, okay, which ultimately causes the thrombosis. Or by activation of the complement system, it also causes the thrombosis. It acts on the platelets, activation of aggregation, expression of glycoprotein 2b3 etc., and ultimately causes the thrombosis. In case of the endothelial cells, upregulation of adhesion molecules and tissue factor expression, and ultimately leads to the thrombosis. So the main aim of these antiphospholipid antibodies are working on monocytes or directly, or the platelets or endothelial cells, ultimately to do coagulation inside the arteries and veins, which ultimately known as thrombosis. So this is the way how it works. So what are the signs and symptoms? APS can cause arterial and venous blood clot in any organ or system, or pregnancy related complications. In APS patients, the most common venous event is deep vein thrombosis. It's a very important line. Deep vein thrombosis of lower extremities, means in the leg. The most common arterial event is stroke. So it can cause problem in the vein. If it cause problem in the vein, it will cause deep vein thrombosis in the lower extremities. That means the main veins which are present in our lower extremities, like we can say for a femoral vein. And if it go for some arterial problem, it can cause the stroke. In pregnant women affected by APS, there is increased risk of recurrent miscarriage, intrauterine growth restriction and preterm birth. So these are the complications which are done by the APS. Let's clarify it with a picture. Here is the picture of the deep veins. You can see this is the iliac vein, then comes the femoral vein, then popliteal vein, then tibial vein. So these are considered as the deep veins, and these are the superficial veins. These deep blue color veins are. Now, what happens when there is APS? You can see, look, this is the femoral vein, considered as the deep vein. So there is areas of inflammation, okay, which is called phlebitis. And in the femoral vein, you can see there is deep vein thrombosis, blood clot. So blood is clotted within the femoral vein. You can see here, and it is called thrombophlebitis. phlebitis. So if there is inflammation for APS, it is called phlebitis. If it is a blood clot, it is called thrombophlebitis. Sorry. So what are the treatment of APS? You can say two names are here. One is heparin, another one is warfarin. Now, APS requires treatment with anticoagulant medication like heparin to reduce further episodes of thrombosis. Means when we apply the heparin, it will, we know all that it is present in our body, so there is no coagulation of blood occurs. So if we apply heparin, then it is expected that the coagulation level will gradually decrease. But warfarin, there is a problem, it cannot be used in the pregnancy because it can cross the placenta unlike heparin and can cause the complication in the fetus. So two things we can keep in mind, one is heparin, another one is warfarin for the treatment of the APS, but this cannot be applied to the pregnant woman. Now, how this heparin and warfarin works? It is called the mechanism of anticoagulation. So, inactive protein C converted into active protein C with the help of thrombin, which is activated factor 2, and thrombomodulin. Now, this active protein C in the presence of protein S helps in conversion of activated 5A, which is very important factor for the coagulation process to be happen, to inactive 5. That means the factor is present in the blood but in the inactive condition. And also activated factor 8 into inactive factor 8. That means the main aim of these anticoagulants, heparin and warfarin, to stop the APS is to convert the activated coagulation factors to inactive form. Like you can see here, activated factor 5A is converted into inactive factor 5. Activated factor 8A is converted into inactive factor 8. So in this way, it controls the occurrence of APS. So these are few questions to test yourself. Thank you very much for your patient listening. Hope you understood well. And this will continue to part 3. So long. Bye bye.